and welcome to Dialogue. During the past 3 years of COVID-19 control, China has stuck to the principle of dynamic zero COVID policy, which constantly created a virus-free environment for the public. With the introduction of the 10 new measures earlier this month, China has, however, shifted focus from infection control to case treatment. What has been the result? How is China doing to protect its people from any upcoming COVID surges? And will the country's economic recovery how will the country, economy will recover from the pandemic? To find out, I'm joined today by Zoon Ahmed Khan, Research Fellow at Center for China and Globalization, Mario Cavolo, Non-Resident Senior Fellow at Center for China and Globalization, and Einar Tangen, Independent Current Affairs Commentator. That's our topic. I'm Xu Qinduo. Well, welcome to the discussion. At the latest news conference on Sunday, an official in Zhejiang province in southern China, which is home to 65 million people, estimated that daily COVID cases there had exceeded 1 million. And if you look at the number from another place in eastern China, the Qingdao city, you can see the population there is about 10 million, and then a health minister there said there were roughly 500,000 new cases each day. So Anna, I will start with you. How do you describe the current situation? Where are we now in China? So the nation is in the middle of a surge, which is probably yet to peak.
Yeah, I mean, you have to put this in context. Quite frankly, China had the luxury because it took precautions early on of saving a tremendous number of lives. But the fact is, COVID is not going to disappear. It is it's going to be here 10 years, maybe 15 years from now, unless science comes up with not a vaccine, but a complete cure. So China opened up at a time when there's a very mild variant that's going around. It doesn't mean that there won't be deaths, but the number of deaths will be much, much smaller. And at this juncture, yes, it is running very, very quickly throughout China, much quicker than any study that I've seen. There was a University of Leicester study in the UK that was a study of all the known outbreaks, and this is much faster. But as I said, much milder.
Mm-hmm. Zoon, how do you see this situation? If you are asked to present the situation to people who live outside China, how do you introduce the situation to them?
Well, thank you, Qinduo, firstly, for having me. Firstly, I will echo, I agree completely with what Einar said, that in the end, we all knew that, dynamic zero COVID is a policy that's there to protect as many lives as possible, for people to make sure that they feel safe. And the one thing, that people outside need to understand is that there has not been panic during the COVID zero policy, and there is no panic right now. Yes, we have seen cities like Beijing has, based on all kinds of assessments and figures coming out, we have already peaked. Other cities are on their way, and this is definitely a very mild variant. So this transition was always going to happen. It was meant to happen. The right time was critical. And that is exactly what we see, that currently the two variants of Omicron that are in China, that are currently, for example, the BF7 in Beijing, it is very easy to spread. And the question is, now we need to move towards being able to treat, being able to cure, being able to make our people and societies in China more resilient. So I think based on this, we see that people are increasingly becoming better prepared. And we will see that, some of the lessons from the cities that peaked earlier will be learned by those that are peaking now.
Mm-hmm. Mario, I think, for a lot of people to understand, a change of direction, a shift of a policy, especially at the beginning, could be tough.
Well, this is exactly right, and it is happening. And since you're bringing that particular point up, number one, we have a situation where the government is clearly acknowledging the situation as it is. You have, as you just said earlier, Zhejiang recognizing that there is 1 million cases a day, and there will be potentially 2 million cases a day. That's just in Zhejiang province. Now, these are numbers, and this is what I want to point out here at the beginning of the show. People in the West cannot understand that even though there are deaths, you're seeing stories about busy funeral homes, busy crematoriums. Well, as a percentage of the population, it is a successful situation, but it's still tragedy. It's still a pandemic. Think about Western cities. For example, people would think a city with 750,000 people in the United States is a pretty big city, actually. So if you have a nasty viral outbreak in a very short period of time in a city of 750,000 people back in the West, there would be, say, perhaps 150 deaths. Well, folks, we're not the West. This is China, where Shenyang is 8 million people, where Beijing is 20, and Shanghai is 30, and Chongqing is 30 million people. So you take 150 deaths and a successful situation of a very low death rate, which you multiply that by a factor of 20 because of the size of the population. So that means then there's thousands of deaths. That's still very, very low, but it's on a short-term basis. Obviously, no hospital, no funeral home is prepared to handle those kinds of numbers. And it means that there's tragedy here that the people are all together embracing. And it's very, very difficult. It's heartbreaking for everyone in a relative way, in a relative sense. This is what people all over the world need to understand.
If you look at the situation in Beijing, obviously, the situation could vary from city to city because Beijing, I guess, like Shenyang, is among the first group of cities that confront or experience the latest wave of infection. Zoon, we talked about the people in Beijing, crowds returning to the streets and also in the restaurants, lining up to get seated. Over the weekend, we are seeing Christmas Eve, and people are also looking forward to the arrival of the New Year. What's your latest observation, the change of the city?
Shindo, that's exactly what I wanted to add after Mario's comment. Because I think one of the most important things is how fast Beijing, a city of 20 million, has actually bounced back. We have seen many more people on the streets. Restaurants are open again. Christmas was festive. And I think that is something, the speed with which individuals are recovering and the city is recovering is beyond remarkable. So, of course, this speaks volumes about how ideal the timing is. First of all, we see that this variant is definitely one that is not that difficult to recover from. We see that people have started going back to the office. You yourself are also in the studio. Our offices are back. People are being able to go to work, being able to go out to restaurants, go shopping. That energy, that positivity is definitely coming back. And this is easily observable. So I think that's also a very positive sign for other cities that, it's going to pass, and it will hopefully pass very soon. And there are just a few precautions. Individuals need to be careful. You just need to make sure you are taking the right medicines and resting when you need to. This is absolutely important. And that's how you can recover at the speed that Beijing is recovering.
Anna, what's your observation? What have you seen or heard probably from friends, from families, or public reaction to the government's change of policy, basically with in early this month, the new 10 measures basically to relax the restrictions, and people basically were ready to confront the new wave of infections.
Well, there's a lot of caution out there. For the first couple of weeks, I had COVID 2.5 weeks ago. During that period, I just stayed at home. I made sure that I had some testing kits at home to make sure that I wasn't infectious if I did, in fact, go out. But the streets were fairly empty. People were not being told to isolate. They were doing it out of caution. And I think that really speaks volumes for the Chinese society, and that they were more than happy to make personal sacrifices, to not go out, to do the right thing in order to keep things under control. So at this juncture, it's really the subways are crowded. There are traffic jams. unfortunately, just as bad as it used to be before COVID. And things are returning to normal. You don't see as many people in restaurants. I eat out most evenings. I see a lot of people there, but it's about half full. But in a week from now, I would expect that you're going to see a lot of people out, and you're going to start to see a very sharp V. That could be interrupted by the situation, with the New Year's, because people are going to be going back home. There's definitely going to be spread. And as I said, though, it seems to be very mild. Beijing will basically be over this in about a month or maybe 5 weeks at the most. So there is an economic interruption, but it's short and sharp. And then things can get back to some semblance of normal.
Mm-hmm. Mario, I know that you did a small survey basically within the business community. So what's the response?
That's right, Chindwa. I want to say that I have a very important update for everyone this evening. Let's remember our audience is international. Ladies and gentlemen, we are not, by trying to ruin and Einar and myself, by telling you the good things that are happening, we're not cheerleading. We're informing you of the reality, of the actual on the ground reality of what's happening. And exactly as Rune said, exactly as Einar said, I checked with the Shenyang business community, the top top managing director level gentleman who knows all about what's happening with all the five-star hotels here in Shenyang. Another manager of one of the major automotive factories. Shenyang is a huge automotive industry up here, and all the other factories that he checked with. Another gentleman in the environmental and energy industry, and another person who I know is involved in the running of a large international hospital. So all of these organizations represent right now hundreds and thousands of employees. And I am telling you, I said to all of them, could you confirm for me what I think, which is that everyone's already back to work here in Shenyang? And every single one of them, and this was less than 2 hours ago, came back to me, and this is what they confirmed. They said, yep, all the factory workers were out last week. Everyone was sick. Everyone, again, Shenyang, 70% of the people, 8 million people, that's about 5 million cases. I'm taking a bit of a guess, but I bet you it's accurate. And everyone is recovered and back to work. So it's moving fast. This is the real situation on the ground. Yes, as Einar said, folks, of course there are some deaths. Of course funeral homes and crematoriums are too busy. That's what happens when 5 million people all get a virus at the same time. This is unavoidable, but know and understand that it is, as a percentage, a much, much smaller percentage. Let's remember the first disaster was actually Italy 3 years ago. Remember how horrifying the situation was in Italy. There were so many deaths. We have 10 times less the number of deaths here right now happening in China because China waited, and a big thank you for that is in order. No matter what anybody says, I insist that is the situation, that is the truth, and that is the reality here.
Mm-hmm. Well, China has announced that the National Health Commission has stopped publishing daily COVID-19 cases. The numbers and the relevant epidemic information is now released by the Chinese CDC, or the Center for Disease Control and Prevention, for reference and research. So, Anna, previously the National Health Center reported just 62,592 symptomatic cases in the first 20 days of December. Some criticized this as downplaying COVID death. What's your take on that?
Well, okay, let's put this into perspective. If you go to the World Health Organization, you have 230 different countries and entities that are reporting back. Of those 230, only eight are reporting the number of COVID cases and tests and things like that. China is actually late to the game on doing that. In terms of the current situation, it's overwhelming. We've already established that. What the Chinese government doesn't want to do is release inaccurate information because they they're very gun shy, especially what happened in Wuhan of being accused of doing anything. So we're going to make sure that the numbers are correct before they release them. That is at least my take on this. If you look, I mean, the United States stopped reporting back in the spring. Europe doesn't report anymore. I mean, this idea that somehow China is an outlier because it's not reporting is hypocritical at best.
Mm-hmm. Well, so my understanding is like if it's just impossible to count the number of infected people because many of them got infected, they would stay at home, and there's no need for them to report to the government. So 7 days or 14 days later, you go back to your work. That's it. I mean, it's really about serious cases or people landed in hospitals. You want to treat those people, take good care of those people. So probably the meaning of continuing reporting the number of infections is very limited, to say the least.
Agreed. I think Chindo, I mean, I completely agree with Einar's point as well. And I'd like to add, what is the purpose? I mean, in the end, we have to think about the purpose right now is to be as well prepared as possible, utilize resources as efficiently and effectively as possible, and to give people as much convenience as possible. So at this point, where we know that, for example, just a few days ago, Beijing had peaked to 70%, and also probably where Mario is from, Shenyang, right? Can you afford to go and take tests person by person? What is that achieving? The real numbers that are important and that are being exchanged is what is the percentage of people that are being hospitalized? How many calls have been made to emergency units? What is the consumption of medicines? These are the important numbers, because in the end, what we are talking about is, like any country, we have their limited resources. Now going to those daily testing booths is, first of all, not convenient for people that are probably recovering. And secondly, those same people, those same resources, very valuable human resources, are being shifted to being able to treat COVID in a better way. So I think it's obviously hypocritical reporting the number of COVID cases. There are estimates, and those estimates are very valuable. But if the numbers can't be accurate, then there is absolutely no point in, it's not an exam. It's in the end, it's about saving lives and convenience and utilization of resources.
Mm-hmm. Well, Mario, at the beginning, basically earlier this month, when the 10 new measures were introduced, many cities actually were faced with the shortages of medicine for these flu-like symptoms, for example, like fever. How should we look at this lack of supplies, especially at the beginning when the policy shifted its direction, when the policy changes? As we discussed last time around, 70% of infection of a population of 20 million in Beijing. And is that a situation like basically unavoidable? Could we have avoided that situation?
Qinduo, I pointed out in the last show how right now in the United States there is a very bad triple flu bug going around. It's flu and RSV and COVID all at the same time, and there's a terrible shortage of medicine, especially for children in the United States. And what else did I point out? This is not a reason to demonize a country. This is not a reason to demonize anybody. You have a medical system there that's under strain due to a very nasty triple pandemic situation happening there. And we have a situation here that I would have to classify as even about 10 times worse than that. Okay, in the West, as I mentioned earlier, people cannot fathom the idea that Mario lives in a city of 8 million people, and in the course of 10 days, 5 million of those people all caught COVID at the same time. What system could possibly be prepared? They weren't ready for that. They didn't expect that to happen. Nobody thought the numbers were going to be like this, but they are. This is real. This is what it is. Of course, there's also here in China going to be shortages of medicines. Of course there are. You can be as prepared as you can be, but nobody was prepared for this. That being said, what did I mention earlier? What did Rune and Einar mention earlier? The cities who are early, Shenyang, Beijing, I think Chongqing, Guangzhou as well, other cities on the early side of this, who are already recovering, already doing much, much better. We're going to get through this. This is a tragedy. Problems are unavoidable. It is a pandemic. It always has been. It's been 3 years. It's not over. We are dealing with a milder variant. That's great news. These are the realities of what we're all dealing with. This is a situation that all of us, as Chinese, foreigners living here, and all of humanity is dealing with.
Hmm. Well, Zoom, what is the situation
Yes.
like now? Of course, Beijing is among the first cities experienced with the latest wave infection. It seems, if you look at the Chinese language news media, there are reports of smaller cities, seems like they are better prepared with the government's inaction to prepare small package of medicines basically being delivered to the households,
Yes.
in particular for those with the existing conditions or with the senior members of the family. Hopefully things will be much better prepared there.
100%. I think, Ishindo, first of all, we already see, I personally know many of my Chinese colleagues and friends who are now also, now we have a relative excess of medicines here in Beijing, right? Maybe some people bought and didn't consume. So they are also sending them out to their relatives, their friends, to other cities that may foresee a wave in the coming weeks. Secondly, I think people probably will not panic buy. That is more probable in a city that's the first to experience COVID. You just don't know how severe it's going to be. If most people are recovering within a week and bouncing back to their old selves within 2 to 3 weeks, that means the amount of medicines you need is also less. So number one, I think people are better prepared. You see also an allocation of resources. Chinese medicine manufacturers are working on full capacity. This is also very positive. And I think that's definitely valuable lessons learned from Beijing's case. And this is all very positive, people. As I mentioned, the biggest difference is that people are not panicked. They are preparing. They are ready. This is the biggest difference. Yeah. And another thing, one small aspect I want to add. We are talking about saving lives, right? This is a point that both Mario and Einar mentioned, that unfortunately, of course, once we are shifting this transition, we have seen a number of fatalities, which are much less than what countries like Italy, Iran, my own country, India, the United States, but at the same time, at this point, opening is saving more lives. This is very scientific decision making. So this is another point to really emphasize that even now, saving as many lives as possible is the priority. And this is something that, maybe the world hopefully can acknowledge in due course.
Mm-hmm. Well, Anna, as Zoon pointed out, so the priority is still to save the lives, obviously, but the public in general welcomed this change of policy since it is much mild and it's a time to open the society, open the economy, and be prepared for economic rebound maybe early next year. So anyway, you need to prepare for that.
Well, yes. There's, when you're in politics, you have to make hard decisions. And, China made some very difficult decisions early on in terms of saying, look, we don't want to be subject to this virus when it's very, very deadly. And years later, 3 years later, they made an estimation. There's going to be a look at how quickly things happen, whether or not things were prepared. Obviously, these smaller cities had it more in hand, but I would pick up where Zoon said, no, and Mario, that no one really anticipated how quickly this would grow, how quickly it would spread. So at this juncture, China has to move forward. And it's not just about China. China has a responsibility throughout over 140 other countries where it's the primary trade things. It has a duty to its people. There are so many small, medium-sized business entities that really bore the brunt of this economic things. Now, China took a deliberate people first. They didn't say, oh, we don't care about people, it's just the economy. You had a lot of that going on in other places, especially the US and somewhat in Europe. And China has taken a different tack. They're opening up at a time, as we have said over and over again, when they think it's safer. We don't know. We'll see when the statistics come out, and we'll be able to judge then. If there was problems, the one thing that you know in China is that they will address them. Those people who are responsible for making the wrong decisions are actually held accountable. This is not a situation where you have a democracy where people, say, well, yeah, I messed up, elect the other guys and then they can mess up and then I can get back in and mess up again. This is a situation where the government takes its responsibilities very, very seriously. They're very, very attuned to what the people are saying and what they want. And so far, they've been able to deliver. But as I said, the jury is still out. Let's wait and see how this goes. Right now, I agree, there's no panic by anybody I know saying, oh my goodness, the world's falling. It is not a reflection of the international press, which on a daily basis is, once again, the China collapse theory. They've been wrong for 25 years, but it doesn't seem to make them stop.
Obviously, it's not like that situation. Mario, lastly, the question for you. Based on your survey with the business community in Shenyang, what's your prediction of the larger environment or the comeback of the Chinese economy?
Chindua, thanks for letting me follow up on this, because this was precisely why I said, wow, I'm going to be on the show tonight. I want to pick up the phone. And I called these, it was 3 gentlemen and 1 lady who were in prominent management positions and said to me very clearly, we are already all in our industries back to work. Okay, so now answering the question, what does that suggest for the future, economically speaking? Well, I think it suggests pretty well, pretty darn positive. Let's get through the let's get through the Western Christmas holiday, and Merry Christmas everyone, by the way, right? And Happy New Year coming January 1st, and then this year an early Chinese New Year, right? January 21st, I believe. And then through February into the spring, it portends well for a very positive scenario, economically speaking. And going back to also wrapping up with what Einar said about the government doing everything for the people, I see an opportunity for the government officials, for Xi Jinping, for the leaders, step up and do like Theodore Roosevelt did after World War II. We've been in a war footing. The Chinese people are in a war footing. It's been a war against this virus. And what did Theodore Roosevelt do at that time? He became very famous for doing fireside chats. So I think that the people of China who are really suffering and fighting now, they want to hear from their leaders. I'd love to see I'd love to see warm and compassionate, more frequent messages from the high-level government officials here. That's missing, and I want to encourage all of them to do that. I think it would be a great addition to what's happening in this amazing country.
Mm-hmm. And lastly, very briefly, without knowing, for 100% certainty, what's the situation like in the next year in terms of the economy, about the predictions?
Well, I think you'll have a sharp V, as Mario has suggested. The issue is, the kind of economic and political headwinds that are internationally. The U.S. continues these policies of trying to contain Chinese businesses, deny China access to technology. And at the same time, you have a global meltdown because of things like the Ukrainian conflict, also too much debt, not enough attention being paid to the situation in these developing countries, and that's going to come home to roost. So those aren't things China can control.
Well, with that, we come to the end for today's discussion. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Xu Qinduo. Thank you for being with us. See you next time.